viewers, welcome to another episode of Chilled Banters. Here we discuss youth-friendly topics, gists, trends, and so on. I'm Eniola Oyemolade.
I'm Favor Boluwade.
And I am Faith Adiri.
Okay, so a few months ago, there was a trending issue on Twitter about a young guy named Izu. Okay, so Izu was accused of sexual harassment by a young lady alongside other guys. According to reports, he tried reaching out to the young lady, but she was not yielding. This issue affected Izu so much that he ended up committing suicide. A particular day on Twitter, we saw a video where he was reading out a letter to his family and friends when he was about committing suicide. So, of course, Izu was depressed about the issue and ended up committing suicide, which is why today on Chilled Banters, we'll be talking about depression. According to experts, depression is a mood disorder. The feelings you experience when you are depressed include loss, anger, and sadness. So we interviewed a mental expert, Dr. Adiola Adeyemi, and she has this to say about depression.
So today, speaking on depression. Depression is a type of mental illness. It is a mood disorder characterized by some major symptoms and minor symptoms. There are three major symptoms, like persistent feeling of sadness, loss of interest, and decreased energy. Then the minor symptoms include loss of appetite, poor sleep, in some cases oversleeping. Some people might experience increased appetite. Some might have loss of libido, then feelings of worthlessness, excessive guilt, and also suicidal ideation and suicidal acting. As you can see from statistics, in Nigeria, over 7 million people have depression, clinical depression for that matter, but only a few of them have access to treatment. And in recent times, with the rate at which people are committing suicide, which is one of the complications of depression, you would know that people are depressed, but because they're not coming out to talk about it, they're not getting help that they need, and a lot of factors make them eventually commit suicide. So yes, depression is real, but the good news is that it is treatable. From the things that people, the symptoms people exhibit, you would know that probably they are depressed, from tearing, weepy spells, getting hungry, outbursts of hunger. All of these can be related to depression, really. So yes, it is real.
Wow, that was really enlightening. Anyways, with the invention of social media, a lot of people have complained that social media has been the reason for their depression. Because you see that on social media these days, everybody wants to just fake it, even if they are not making it. They upload their fleet of cars, their travels, their children, their families, and so on social media. There's someone who has not even done up to that, start feeling somehow and feeling like they cannot succeed in life. And this has led to a lot of feelings of depression and sadness. Aside social media, for social media, a lot of people too say that they get depressed because of their loss of life. They probably lost a loved one, their husband, their wives, parents, and all that. And some people ascribe because of their depression to failure, probably because they've done an exam and they didn't pass it. So a lot of people just say depression is caused by so many reasons of sadness and loss.
Yeah, so a few years ago, something happened on Twitter. There's a guy that he actually failed JAMB. So he came on live video on Twitter and he poured insecticide into a cup of tea and was sipping. You could see the way he was holding his tummy, you could see the pain inside and all. So he actually tried to commit suicide. He didn't die actually. So that day, a lot of people were saying that there's nothing like depression. And the argument is, we all feel down and sad.
Sure.
If you actually feel down and sad and we call it depression, does it mean that everybody is depressed? This is what Dr. Adeyemi has to say about the causes of depression and whether depression is real or not.
Speaking of the causes of depression, using the biopsychosocial model, that is the biological, the psychological, and the social model, there are some factors that have been associated with the etiology of depression. And speaking of the biological, we're talking about genetics, meaning that it is heritable. People who have someone in their family with depression are at higher risk of having depression as compared to the other people who don't have. But that does not necessarily mean that once you have a family member with depression, you're going to calm down with depression. So please calm down, all right? All right, then other causes, like maybe a twin might have it, the other twin is more likely to have it. The bottom line of the biological is that it is
irritable. Then another thing, it says some chemicals in the brain have been associated with the etiology of depression. I mean, the causes of depression. Some chemicals that actually, they call them happy hormones. They are neurotransmitters that are meant to be in a particular level in your brain. So whenever there's a decrease or an increase in these chemicals in your brain, you might come down with symptoms of depression. And that is where medications are very, very useful and important, because these medications would, regulate these chemicals in your brain to ensure that you come out of depression. So that's about the biological causes. Then coming to the psychological causes, more of the way a person think, the way a person feel and the way a person behave. So there's actually a link between the way you feel, the way you think the way you think, and then it leads to your emotions. Once you have a negative thinking pattern, you have a negative thought, it might lead to how you feel. You start feeling sad, and then it can also affect your behavior. You become irritable, you keep to yourself, all of which are symptoms of depression. So there's a cognitive distortion. If there's a problem with your thinking pattern, if you have a negative thinking pattern, you're more likely to come down with depression. Personality also, some personality have been associated with the etiology, the causes of depression, like the melancholy personality, and neuroticism is also one of it, and all of these are associated with negative feelings and negative emotions, basically. And also the social factors. Like maybe if there's a loss of job, loss of parents at a very early age, loss of loved ones, crisis in our society. COVID-19 is one of them. A lot of people have been depressed. I've seen a lot of patients in the hospital where I work that have come down with depression on account of COVID-19 pandemic. Of course, the reasons are not far-fetched because of loss of job, loss of close relative, the isolation, the lockdown issues, and a whole lot of things. So yes, these three things can lead to depression.
Yeah, some have said depression can lead to self-harm, substance usage, or even suicide, just like the case of Izu we mentioned earlier. So how can depression be prevented exactly?
Experts have strongly recommended having a good and healthy relationship can help to prevent the issues of depression. What does this mean? It means that whenever you're feeling down, you're feeling sadness, you're feeling like you can't contain your issues alone, try and speak out to somebody. Reach out to someone. It could be your family, your friend, your colleagues, even your religious leaders. Just make sure that you are not alone and don't isolate yourself.
Yeah, and of course, try to avoid substance usage and self-harm. And if there is a particular person that triggers your depression, try and move away from the person. Yeah, it's not easy, but just try as much as possible.
Also, exercise, eat well, sleep, and avoid stress as much as possible. So, according to Dr. Adeyemi, these are ways to tackle depression.
So, speaking of the way forward, well, like I said in my opening statement, that depression is real, but it is treatable. So yes, depression is treatable. We need to first of all understand that. And then number two is that no one is immune to any form of mental illness, including depression. So don't feel that, oh, because you don't have it in your family, then that means you can never have it. It could happen to anyone. Like I mentioned, other factors that could lead to depression. So one of the things is that we need to keep creating awareness about depression. Let people understand what the symptoms are, and able to identify these symptoms early enough and get people who are depressed, to source of help. So we need to do this, as a society. People need to be there for each other. You have to be very sensitive to your friends, to your family members. If you notice any change in their behavior, someone that has always been up and doing, a happy person, suddenly becomes sad and withdrawn to him or herself, then you need to find out. We have to be kind, we have to show empathy, and we have to, stop this stigma behavior. We have to stop discriminating against people with mental health disorders so that they can be bold enough to seek help. We have to be our brother's keeper, of course, and then we have to ensure that the discussions about mental health is normalized. We need to make it like, okay, normal physical illnesses like headaches and malaria, and let's just normalize it. Like mental health problem is just like a brain disorder, and just like you have cardiac problems as well. So this will reduce stigma.
we need to encourage people who have depression to come to see the doctors, to come to see a psychiatrist. And once they start treatment, like I said, the biological treatment, medications, the psychological treatment, psychotherapy sessions, and of course, if they get support from their family members, they would be fine.
Yeah, and of course, we'd like to hear from you, our viewers. Have you been depressed before? What steps did you take? And do you even think depression is real? Drop your comments in the comment section. So we'll come your way again next week. I'm Eniola Oyemolade.
I'm Favor Boluwade.
And I am Faith Ade.
See ya.